when I think about the severe scoliosis that I treated, which had a 30-degree S-curve scoliosis, she was a surgical candidate, and she had been seen in a private physiotherapy clinic for many, many months, over a year. She was braced and they were trying to push her back, plus she had exercises to do. Well, it's like putting braces on your teeth. You can put braces on the teeth, you can make them straight, but we all know when you take the braces off, they move, and people are putting permanent retainers in to hold them where they are. Well, why would they move if they're straight? There's forces. They've, you know, kids get pulled out by forceps. They have a lot of trauma to their head. As a toddler, their heads are large. They stand up under tables, they fall out of high chairs, they fall out of wagons, they fall downstairs, they hit their head a lot. And I believe the primary restrictions that just happen with life contribute some to why teeth move after they're straight. There's energy there, they're being pulled. So scoliosis also, this girl improved immensely. She was away at school and couldn't come as, you know, out of town. She couldn't come as often as I would have liked. The young girls that I've treated, one treatment, I feel bad saying that, but one treatment, they were normal, the pain was gone, they carried on. That was it. I could have given them as many exercises, you know, stretches, strengthening, different things to try and pull it straight. I do not believe it would have straightened, and the exercises would have been, you know, after a while boring, and the child probably would have stopped. The other girls that I saw this week, the two, the one I feel I might give her probably a little bit of a treatment next week, and I really don't think she's going to have any other issues unless she has another impact. And the younger one is a little higher energy. She needs a bit more work, but I don't want to. People get better, which probably isn't good for business, but they get better, so they don't need to keep coming. Not everybody's like that, and the older the person is and the more trauma they've done to themselves, the more work it involves. But the nice thing about matrix repatterning too is if you're not just treating one injury, you're treating the whole body. So not only does the problem they came for better, but all the other things that they had going on in the body better too.
We see a number of cases responding very well. Of course, they have injuries on top of that torsional pattern, so we have to address those as well. But this background torsional state can be improved upon to reduce the amount of twisting in the spine. And really, scoliosis is not so much a curvature of the spine in terms of lateral curvature as seen on x-ray. It's actually a spiral strain. It's literally a twisting of the entire spine into a spiral state. And that affects the rib cage, it can affect organ development, it can cause back pain. There's lots of complications that arise from that. So we have seen some significant benefit in treating those cases.
I had a couple young girls that, whether they had a scoliosis or not, they were twisted, their shoulders were unlevel, their pelvis unlevel, and after I normalized all the energy, I've had 3 young girls I've treated that in one treatment, everything is leveled out. And I feel, especially with scoliosis, I've had a huge amount of luck normalizing them. And I wish people would bring their young children, get them treated. And I think a lot of these scolioses, which lead to sometimes surgical interventions down the road, could be avoided.